Okay, just okay. Today I am hoping to record two videos. One, or maybe even three potentially. One about illness and health. That's this one, and then one with some more medically related things because I've mentioned on this channel before. I'm a medical student, and I'm learning BSL. Hopefully to speak with patients. Not fully, because there are some really nuanced things that I don't want to be getting wrong while diagnosing patients, but just to be able to have a bit of a dialogue around what I'm planning to do with someone who's deaf. I'd like to be able to offer BSL as something I can communicate using. Okay, illness and health. My head will be chopped out because the camera's focused around here where my hands hopefully will be. Don't mind that. Okay, right then. So, illness. Little things are bad, remember? Little things are bad, thumbs are good. Illness and health. Illness, health. And we'll be talking firstly about how we're feeling. We could feel sick, just generally in a nauseous kind of way, and that would be a stomach. Like a child saying, oh, my stomach's sore, I'm feeling sick, generally. Sick, nauseous. We could be sick, the action of vomiting, that is sick. And then we could be ill, sick, poorly, if you have all those words for it, and that would just be the same. So, ill. Okay. Headache. There are two signs for headache. We can have a palm on a head, headache. Or, I have to get my head in properly, otherwise it doesn't work. Headache. Or headache. Two spiky fingers poking to the point where the pain is. Headache. And then pain, generally, pain, and to hurt, same thing, pain. So you could ask a patient or anybody, pain, where? Where does it hurt? You could feel cold, you could feel hot, like you're mopping your brow, so shivering and hot. Those are temperature related things. You could have a cold, and that would be cold. So that is like blowing your nose, I imagine. That's how I think of it. Cold. A cold. A cough. Like you're clearing your chest. Cough. So temperature, I talked about. The sign for temperature is temperature. Like your finger is the thermometer, and your hand is showing the sliding scale that the thermometer reads. And so if you were to measure, take your temperature. This is the sign for examine your temperature. You could have a fever, potentially, and that would be a temperature that is high, so a high temperature fever. Okay. A bruise. A bruise is a little circle on the skin, generally kind of blue coloured, so a little circle, and they could be anywhere, so bruise, you can show where it is, bruise, anything like that. And then sign for break is made out of two motions. The first motion is the snap, and then the away. Break. Okay, I've talked about you can have bruises, breaks in different parts of the body. So your anatomy is just from pointing to that body part. There aren't words for the body parts. You just gesture to them, because if you have the body part, you can point to them. So eyes, ears, nose, yeah. You can point to the area exactly to show where pain might be, or a bruise. So anatomy of body parts, I'm not going to go into. You just point to wherever you're referring to. Some more general feelings that are to do with health. Out of breath. When you're out of breath, you are needing more air, and you're breathing more deeply than you would normally. So out of breath is, and you use your hands to show that you're inhaling more forcefully. So out of breath. Thirsty is like you have a dry throat. Thirsty. And that is actually the sign for dry. Thirsty. Or I imagine I'm probably not looking straight into the camera most of the time. Don't mind that. I've got a little monitor off to the side. Sorry, I should have thought of that. Okay. Thirsty. Dizziness. Dizziness is everything that is spinning and you're confused by it. So dizziness is a little circle. Ooh, dizziness. Or you could have dizziness because your vision's a bit clouded. Dizziness. you could feel faint. Now I like this sign, it's quite expressive. So your fingers are like a person and they're feeling faint. They've gone standing up, oh I feel faint, they've fallen over, they're faint. Hopefully that doesn't happen to people. They feel faint and they sit down, but the sign is there, as though they've fallen over. To be flushed or blushed is like your hands are gesturing to your cheeks. They're red, flushed, blushed. And the opposite of that, therefore, would be pale white, pale, pale, and you could use the sign for white as well. So pale or pale white. Little C shape down the front of your face. Pale. Okay, excellent. So we've said illness, generally ill, and for healthiness, to be healthy or well, is the same as health. Healthy. The sign for fit, you could say exactly the same thing, the same sign, or you could say fit with your thumb from your chest. Thumbs from your chest, fit. The sign for pregnant, pregnant, pregnant. Very expressive, very explicit in sign language, so it's clear, pregnant. You should be careful though, because, well, no, something I've noticed which I find quite amusing, the sign for farmer is from the stereotype of a farmer with a belly. And so the sign for pregnant is very similar to a farmer's belly. But that's just me noticing that. Okay. Keeping fit. This is the last sign. To keep fit is keeping fit. And you could do that in a gym, and the sign for keeping fit and the sign for gym are exactly the same. Keeping fit. Awesome. That is all of my general feelings of health signs, and in the next video I'm going to do some more specific medical, emergency, treatment-y kind of things. Check that one out. Thank you. Right. That looks like it's working. So I'm using a new camera, which is exciting. We'll see if it stays in focus. It's focused here, where hopefully my hands will be. But I've no idea how it will come out. It's all very exciting. Okay.